Alive and Well STL is a presentation of the St. Louis Regional Health Commission and RareGem Productions to build a healthier St. Louis. Power up with the positive. Learn more at OneRareGem.com. That's OneRaregem.com. The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL. Today, you can find Alive and Well ambassadors all over, even at the level of healthcare providers.
I think what excited us about this work is that it addressed issues on multiple levels, not only just for the patients coming in the door, but the staff as well.
It's exciting to see the Alive and Well movement carry forward from the providers to their staff and to the people they serve. This is producer Jade Harrell. We'll be right back. What can you do to help someone be alive and well?
Every person in your life matters, and what you do is when you ask them, how are you, you really care about the answer.
Yeah.
This society will go up to the person, the people they know, the people they don't know, hey, how are you? And they're not ready to listen to that answer. And so the people who respond to those questions usually say, okay, good, or fine, because they know that someone else is not ready to hear that they're having a terrible day or a wicked mental health month or year. When you are interacting with people around you, get off your phone, look people in the eye, and when they say they're having a bad day, instead of going, I really have to get to that next meeting, sit down, hear them, really hear them. Don't just listen, hear them. Hear their pain, and offer assistance in the form of a hug, a smile, an embrace, or all of the above.
You could be their hope simply by having the heart to hear. Everybody should be alive and well. Learn more at aliveandwellstl.com. Alive and Well STL. Meet the ambassadors who bring the Alive and Well STL training and education to the healthcare providers space with their organizations, to their staff, and for the people to whom they provide care.
Hello, this is Caroline Day. I'm the Chief Medical Officer at Family Care Health Center.
My name is Veronica Richardson, and I'm the Vice President of Corporate Compliance and Quality Improvement for Affinia Healthcare.
It is truly my great pleasure to have you in the studio with us to share about Alive and Well STL Ambassadors Program. First of all, how did you hear about Alive and Well STL, and what did you hear that made you want to become an ambassador? And I'll start with you, Dr. Day.
So I had actually heard of the ACEs study and the impact of trauma on physical health, which made a total sense and an eye-opener. Dr. Heidi Miller works at Family Care, and she and I had been talking about the ACEs study and trauma-informed care, and then lo and behold, we got an invitation from Regional Health Commission to be a part of a collaborative, and that just cinched the deal.
What does cinched it mean? Like, what made you say, hey, I'm for this, and I want to actually plug in and get involved?
Well, I think that as providers, we always want the best for patients. And a lot of times we really struggle with, I've made some recommendations. They don't seem to be syncing. You've come back and are struggling in the same way. And it was an aha moment to realize that you're probably struggling because we're not patient-centering enough to understand where you're coming from and what your needs are and to put you in the driver's seat.
Now, as a physician, you said that was your aha moment. Patient-centering means what to you?
It means really understanding in a respectful way where the patient's coming from, how they're hurting, and what they see they want to work on.
Right. And the way that we have been doing it looks more like what?
Well, certainly in my education, it's a matter of hearing the symptoms and diagnosing and then prescribing, and that doesn't allow for a lot of listening.
Okay. Veronica, what about you? How did you come to find out about Alive and Well STL, and what did you hear that made you want to plug in?
Affinia Healthcare, we actually heard about Alive and Well through the Regional Health Commission. And so as our CEO is a part of that, we were also invited to apply to be part of this work. And I think what excited us about this work is that it addressed issues on multiple levels, not only just for the patients coming in the door, but the staff as well. We have had experiences with both staff and patients coming in, and sometimes there's a clash which does not promote healthy exchange of information. And so we felt like if we could train the staff and make them more trauma aware, as well as make them more trauma informed about the issues that are going on in their life, that there would be more productive interaction between the patients as well as the staff.
Absolutely.
And so that's why we got involved, because it just seemed like the right thing to do. And with all of the things going on in St. Louis City, why not provide this opportunity to the staff as well as the patients, so the patients can also improve their understanding of what trauma is. And so the staff would actually know what trauma is. I think a lot of times we think we have a myopic view of what trauma is. And so this just kind of opened up the whole door, and it's just like, kind of like Dr. Day said, this is another aha moment. And what resources do we have available that we could share with the staff and share with the patient?
All right. So let's dig a little deeper. What do you see more clearly now as it relates to the things that you referred to that's going on in the city? And maybe we can pick out a couple of specific things that this is great for. Now, I respect and appreciate what Affinia has done to partner with the Regional Health Commission with the Alive and Well STL program, as well as making sure that their staff is informed to better serve the patients and the clients that they serve. On a personal level, the aha for you brought clarity in what way?
That our staff actually suffers from trauma. We had a all-staff training in which Alive and Well came and trained all of our existing staff. And one of the comments on the evaluation that blew me away was, I finally know what to call it. Because there was a staff member who had been dealing with the day-to-day up and downs of life, and it was kind of like, I don't know what's going on. But then when she had the training, she could name it. And once she could name it, she could actually go get help. Because we have employee assistance programs that people can, it's part of their benefits package. And so just reading those comments just kind of said, wow, this was needed on so many levels. And with the expectation of the staff being healthy, they can now provide good health care to our patients.
And from a very relevant perspective, what aha moment just happened in this studio is that, okay, the healthcare staff are people. It seems such a natural thing to know instinctively, but when you said it, it occurred to me, and also, again, like we were tying into the things, the goings on in our city and our region, that they're going through them too. They simply are going to work and serving people who are going through, but they are going through too. And why then would there be a difference in the needs of our clients and not the care being applied to ourselves? In that moment, we discovered that having a language for it, once we can create a language around it, we can address it. Dr. Day, talk about some of the language that you've come into now from being connected to this work and how it may help in what you do.
So I think one of the key questions that everyone has grabbed onto is what has happened to you as opposed to what's wrong with you. And I think that helps in every situation. You know, somebody comes to the clinic on the wrong day because they think their appointment was today and not yesterday, and they may be really kind of irritated that they're on the wrong day. So instead of the staff saying, I'm sorry, your appointment was yesterday, it's like, welcome, what can we do for you? Unfortunately, your appointment was yesterday. Let's figure it out. So it's a much more inviting, opening tone. And I think, you know, a lot of that is based on understanding the perspective of, you know, people come with a lot of emotion. They come with a lot of things that have happened to them, and it doesn't help them to seek their care to be confronted. It really helps them to be welcoming.
You said a word that is key, creates an opening.
Yes.
An opening that allows communication between you and your patients and clients. An opening that gives them an opportunity to process and work through whatever that thing may have been. And as well as an opening to receive the care and discover the things and the resources that can help improve their outcome and situation overall. Let's get into a little bit of your superhero story, ladies. Tell us a little bit more about you and your role and what brought you to health care in the first place in the role that you're in.
What brought me to healthcare is, I would have to say, growing up as a child, I had an aunt who was a nurse. And part of my aftercare is when my mom would pick me up from school, she would drop me off at Yateman Health Center where my aunt worked. And Yateman was one of the early FQHCs on Grand and St. Louis Avenue.
Now, what's a FQHC?
It's a federally qualified health center.
Okay.
And so that's where I would spend my time until my dad came and picked me up.
Yeah.
So I was probably doing a bunch of stuff that I had no business doing, running labs back and forth, but it was that community aspect. I saw them go and get women off the street who were being beaten up by, their significant others, husbands, boyfriend, bring them into the clinic, make sure that the babies were okay, call the police, just all sorts of things. The elderly, they would bring them in, and if they hadn't had anything to eat, everybody would give up part of their lunch, and that just spoke to me.
Yeah.
And it's just like, man, when I grow up, I want to be able to do this.
Yeah.
And so that's how I ended up. I worked in the hospital for a while, but when the opportunity came for me to work at a community health center, I thought I had died and gone to heaven because that was the type of work that I want to do. Being in community, everybody coming together for a common good and a common cause to make life a little bit more easy or a little bit more tolerable, because we all have our good days and our bad days. But I just thought if I could be part of that good day and doing something that would lift somebody else up, that's what I want to do. And so I started working at Grace Hill neighborhood health centers, and then I went away to Boston for a while and worked for the Institute of Healthcare Improvement and ended back up there where it's now Affinia Healthcare. So that's what drew me to the whole community health arena.
Yeah. When you first started to share, my initial thought was, she had the exposure of the environment. But you really brought it into view with the idea of community and how that collective energy went into helping a person, that we all pulled together to make things better. And I hear in that commitment the alignment with Alive and Well STL. And when did you sign up to become an ambassador?
Oh, I signed up probably. I'm like, as soon as the RFP came out, it was like, yes, we are doing this. Absolutely. So we've been involved since the beginning.
Yeah. So what significance has it made? And share an example of where it really touched, moved, and inspired you.
I think just bringing awareness to the situation, and I guess I like it through the staff experience, because if the staff is on board and they understand it, it's kind of like, when you know better, you do better. Yeah. So when those patients do come in the door, they can say, what happened to you?
That's huge.
Or how can we be of assistance? What do you need? And so I think looking at it from the staff aspect was the biggest eye-opener for me, not knowing what to call it for myself. Also thinking about, if I'm going through this, Oh my goodness. My children are going through this.
Yes.
My husband is going through. My entire family could be going through this whole thing. So kind of blowing trauma up and saying, it's not the post-traumatic stress trauma that we normally think about, but it's not having a good school system. It's not having a safe environment. It's not having good health care or access to health care. That there's, it's not having food to eat. That's traumatic when you have growing children and there's no access or any way to get food. And so just bringing those resources to bear to help answer, when you look at it in itself, I think that trauma is made up of so many different elements. And then once they're all compounded in one person, you talk about building some resiliency, but how long can that go on?
Exactly.
How many times I often think about when I was younger, I had the little punching bag that would always bounce back. But after a while, it stopped bouncing back. Yeah. And so what can we do in the healthcare arena to help people keep their bounce back?
Absolutely.
Like, you're not in this alone. Yeah. We're here to help you. Yeah. We're going to help you bounce back, even if we have to push you from the other side.
Right.
Or
reinflate you.
Right. Whatever we need to do, because that's what we do.
There's something to feel amazing about. Mm-hmm. Very nice. So, Dr. Day, what about you? When did you discover your superpowers?
Well, it's interesting because I actually, grew up in a home of an engineer and a teacher. And so I knew about the desire to do problem solving and to reach people and to make a difference. But I actually got trained as an engineer and quickly realized that I like problem solving, but I want it to be with people.
Okay.
And
Powerful.
So, and I had in medical school knew I wanted to do primary care and did a National Health Service Corps where I was in a rural community with migrant workers.
Wait a minute. Let me rewind your tape a little bit. You knew you wanted to problem solve with people, but entering into medical school, now that's a level. Why that as opposed to another area or profession? What about the medical?
Well, again, I think it's the desire to make a difference, the desire to help people and to be in a teaching role that's at the level of one's health is just what made me tick. And it was a different track for me. I hadn't predicted it as a child. So many people that go into medicine know that they want to do it from a young age. And I think through my medical school, which was a struggle. It's not easy.
Medical school.
Yes.
Good on you. Yeah.
I chose family medicine, which is very holistic and very respectful of the fact that healthcare really is delivered as a team. Yeah. So for me, eventually landing in an FQHC made sense because we can do all sorts of services for people in their family. And obviously, we're just one resource for them. I have so much respect for the educational system and teachers because, it's a combined effort to meet people where they're at.
Yeah. And you found your way there. So enter Alive and Well STL. What significance did it have or does it hold? And how have you been touched, moved, or inspired by it?
Again, I think it's that frame shift of the team, giving time and attention to the team. One of the things we've done is we've created a Zen room where people can just go chill because I think, we've not given enough language to the fact that our work is often very stressful. And, sometimes you have somebody who's very upset about their care and you, whether you like it or not, take it a little bit personally and get ruffled. And you need time to just reset. And it may be that you were particularly set off because of something that happened to you at home. So it's just, it's respect for that kind of chronic stress of work. Yeah. everyone at our place is, really married to the mission. So they come back time and time again, but that doesn't mean we don't need to take care of each other.
Absolutely, along the way. So you brought up the magic word, care. What now do you incorporate into your self-care that you drew from or maybe have been inspired by with Alive and Well STL?
I think the whole idea of breathing and, finding time to, just reflect on things.
Dr. Day, we're calling you. I get it, right?
Yeah, just because, my buttons get pushed both at home at work, and I don't like that, and you keep thinking you can will it away, but that's not reasonable. Right. You got to do something that helps you to reset and, reflect.
Yeah.
And I think that's been neat for all of our staff to recognize that that's important, and that we recognize that it's important, that we really are a team and we need to support each other.
Sure. How are you different with your staff?
Well, I think just recognizing when they're having a hard time, it's also worth asking what's happened to you, because a lot of times they may need a day away because they've got something to deal with. Or they may need to process with another coworker what happened and where tension developed.
I love that.
So I think it's just a respectful listening that has been injected, and again the respect that physiologically stuff has a long-lasting impact, and if we're not taking care of it, then we're not building resiliency.
There you go. We want that punching bag that we become at times to have some give back, and some bounce back. So how about you, Miss Veronica, on your self-care? What's been incorporated or inspired by Alive and Well STL?
I think for me personally, to realize when I stopped breathing, I didn't realize it until, I was sitting in class, they were like, breathe. And I was like, I haven't been doing that. Okay. Because you're so used to going all the time, and actually taking the time to step back and to do just that, to listen to your body. And it doesn't, if you do it for a minute or 30 seconds, just to kind of get you refocused, get you re-energized so you can go back out there and fight another day or the last half of your day or whatever it may be.
Right. I'm glad you said that too, because you know what? Maybe it is a reset in the middle of the day, the last half of your day included. So how are you different?
I think I'm different because I have tried to step back from a situation instead of being pulled into something. I take a step back and say, okay, let's try to look at all the pieces here. One is directed at me. No. Okay, so how can I assist in helping this? And so that has helped me keep my shoulders down from my earlobes, so to speak, because I'm not as tense when you kind of take the time to step back and assess the situation. But a lot of times we don't have that luxury, so you have to learn to do it quickly.
Yeah.
But I think
you have become aware to do
But I have become aware to do that and breathe.
Yeah, and breathe. Breathing is key. All right, ladies. Well, I want to kind of wrap here with a couple of invitations. One, if you could put the Alive and Well STL learning, language, and opportunity in a box and give it to someone as a gift, who would you want most to have it? And what do you want them to gain from it?
I would give it to the educational system.
Okay.
Because there is the core of our learning and our future in those children. And if they learn what trauma is, and if they learn how to deal with their situations, it's kind of like, everybody doesn't grow up the same way. Everybody doesn't have the same economic advantage. And so if we could give it to our teachers so that they can impart it to the children, no stigma attached, but make it something positive, I think the next generation will be a lot better at this, because we're just learning it and we're kind of sliding out the way. But I would give it to the educational system.
That's great. Imagine the impact that they can have.
Right.
If we're seeing the tremendous results of when we get it,
Mm-hmm.
Woo! What about the children and the teachers? Pretty neat.
Yeah.
All right, I'm going to change it a little bit for you, Dr. Day, and that is if you could pass out some ambassador badges or have a Alive and Well STL ambassador party and invite folks over, who would you have come over and what would you want them to part with?
I guess I would invite a group of parents and maybe police officers. I just feel like, that's a similar role in that you're trying to direct traffic, so to speak. Mm-hmm. You're trying to be sensitive and understanding and promote growth.
I get that.
Certainly in my own struggles of parenting and having trauma-informed care, I'm really awakened to, the delivery of non-confrontational, positive dialogue. And I just think that because those jobs are so difficult and have such a rippling effect, having a party where we're honest about that, I think would be really powerful.
That is. Let folks know, Dr. Day, where they can connect with you and your work and come get respectful, which I heard you say, considerate care with their family's health needs.
Excellent. So, again, I'm from Family Care Health Center. We have 2 sites, one in the Grove or Forest Park Southeast and one down in Carondelet. And we are ever growing and changing and trying to deliver patient-centered care.
All right. Is there a website and phone number for us?
It's familycarehealthcenter.org.
Got it. Thank you. And Veronica, what about something about Affinia where we know that there's a staff that can understand what folks are going through and have been trained to know how to address and ask the key questions?
You can reach us at www.affiniahealthcare.org. We have 4 sites along the I-70 corridor, and all the sites are listed on our website. So there's a location on Biddle. There's one on West Florissant. There is one. We have 2 centers on the south side on Limp and on South Broadway. And we also have a dental school that's located at 1500 Park Avenue.
Perfect. Thank you, ladies, so much for joining me today.
Thank you.
Yes. It's exciting to see the Alive and Well movement carry forward from the providers to their staff and to the people they serve. There's still plenty of room for you, and we've got plenty of work to do, St. Louis. So become an ambassador. If you're interested in being a part of Alive and Well STL and helping continue the conversation, please visit aliveandwellstl.com or email aliveandwellstl@stlrhc.org. We're excited to have you join us with the Alive and Well STL movement. Alive and Well STL is now a community-wide effort focused on reducing the impact of stress and trauma on our health and well-being. The research is clear. Stress and traumatic experiences are making many of us sick, and together are the leading cause of poor health outcomes. Take 5. Visit us at aliveandwellstl.com to find out where you are emotionally. Become an ambassador. Reach out and help build a supportive community. Learn resiliency skills. Get the help you need. Share your stories. Hear others. And learn more about stress and how it affects us. That's aliveandwellstl.com. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.